Welcome to Citrine Health Presents, where we provide connections to social service agencies and programs that may be of benefit to you. My name is Ann Miles, and today I'd like to welcome Emma Gardner, the manager of the bra shop at Citrine Health. Welcome, Emma. We're glad you're here.
Hi, thank you.
Tell us a little bit about the bra shop. Who is it for, and what is your role here?
So the brush up is for post-mastectomy and post-lumpectomy patients. And my role is that I fit these women for their durable medical equipment. So specifically their pocketed bras and a breast form or breast forms, depending on their surgery scenario.
And what is your background in that you can fit people for that? Have you had special training?
Yes, I went through pretty extensive training. It takes, well, depending on how quickly you can acquire your hours of experience, it took me probably 6 months to a year to get to the point where then I could go and actually take a test to get certified. And then since I've had my certification, there are specific continuing education requirements to maintain that certification that I have to do annually. So.
Oh, that's wonderful. Okay. What's a good time in a woman's cancer journey to access these services?
Yeah, that's a great question because it's very individualistic. It's really based on, how the individual is feeling. I have patients that come and see me, before their biopsy. I have patients that come and see me before their actual surgery. Most of the time, though, I'm fitting women post-surgery, so they've had their surgery. However, I can't see them until at least 6 to 8 weeks post-surgery so that they're fully healed up. At that point, then I can measure them and fit them for their product. So, but it totally depends on the individual. I'm always available for a consultation. There's always lots of questions and, concerns. So, I always say I am available anytime. So always call if they have any comments or questions or concerns. So that's why we're here.
Good. So they can call you to get information ahead of time before they come in and actually get a fitting.
Yes, certainly, because some hospitals in the area provide a post-surgical garment, but some don't. So if they don't know whether or not their hospital provides that, they certainly want to call to find that out, because if the hospital isn't going to provide that to them, then they should come and see me before their surgery. The way insurance works, though, it's kind of funny. They don't actually let the patient, I can't dispense the actual garment until after they've had their surgery. So, but they should come and see me before.
Okay. What can a woman expect when she comes to the bra shop?
Um, Definitely that privacy is our number one concern. Our fitting room here in our new location is awesome because there's a fitting room built inside the actual suite, and it makes the entire suite an actual fitting room. But then, as I just said, we also have a built-in, more private fitting room as well. I will take their measurements. I take 2 measurements. So I measure around their rib cage. And that would be it if they were bilateral. So if they've had both breast removes. If they're unilateral, I'll take a measurement of their remaining breast. And then we go from there, and they'll try on bras and different sizes of breast forms. So.
So you have breast forms for women with lumpectomies, correct? And can you explain what a lumpectomy is and why she might want one?
Yes, certainly. So a lumpectomy isn't a full removal of the breast like a mastectomy. So a lumpectomy is just a portion of the breast has been removed, and it can be anywhere on the breast. It totally depends on that individual surgery and where the cancer was found. And then we have a balance kit. So they're different forms than a mastectomy form. The balance kit has all different shapes and sizes, thicknesses. And then I just try to basically fill in the space that's missing to, make them feel comfortable again, to make them as close as possible to feel like themselves again. A lot of lumpectomy patients end up not even needing a partial or a balance form. Sometimes the removal or surgery site is so small that if they have on a molded cup bra, sometimes they just need the bra, because with the molded cups, it actually does a really good job of concealing whatever type of like lumpectomy they had. So it just depends on the individual, and everyone is so different. I would say just come see me. I like everyone to know their options, because until they see the kit and all the different options that they have, they might not even, they might not know.
Are your services covered by insurance? And does she need a referral for that?
So yes, again, that depends on the individual's insurance. Some insurances do require a referral in addition to a prescription, but if a patient's going to bill their insurance, they all have to have a prescription. Just certain insurances like Kaiser and Humana do require an additional referral. So Medicare would cover 80% if they've satisfied their annual Plan B deductible. This year, I think it's an annual deductible of $240. So that has to be satisfied before Medicare will kick in the 80/20. So the patient, if they just have straight Medicare, so nothing else, no secondary, then they do have a 20% coinsurance. However, if the patient does have a secondary, most of the time it's 100% covered. It just, again, depends. So I always say, call me because I can, once I have their insurance information, I can call and verify their benefits and eligibility for them. So
What if they have a Medicaid insurance or an Apple Health?
yeah, it's typically at 100%. So
Oh, excellent. Okay. Where's the bra shop located? Are there a lot of bra shops around, and where are you located?
we are in Everett, Washington, and we actually just moved into our new location. So we are in the Everett station. Some people like to call it the Everett train station or the Everett bus station. And yes, that's where we're at. We're on the second floor. We are by appointment only though. So you can call me to schedule an appointment.
Okay. And are there other bra shops that they could go to, or are you the only one?
We're the only bra shop that's north of Seattle and Bellingham. There are not necessarily like bra shops, but there are places that a patient can go in Seattle that could dispense their durable medical equipment for them.
And durable medical equipment is a phrase that they use when billing. Is that correct?
Correct. Yes, that's it's very specific. If a patient wants to bill, yes, they need to know that the pocketed bras and the breast prosthetics or prosthesis are called durable medical equipment. Really important because that's how they're defined. So,
Well, how can someone contact you?
they can email me, they can call, and I think there's going to be a link on the bottom of this of the screen where they can also go to our website. They can also contact us through Facebook as well. So there's about 4 different ways they can contact us. And I'm sure all the information is going to be down at the bottom.
It will be. There'll be at the bottom, at the end of this video, they'll be able to catch all that information. And again, they can call at any time, right? And contact you as well that way.
Yes.
So that's excellent. Well, thank you so much, Emma, for all your information today. I think it's an important service that you offer the community, and it's wonderful that we can give people information about how to do that.
Yes,
so thank you again. Remember, the information about the bra shop is at the end of this video if you need to do that to contact Emma. And our other videos that may be of interest to you are available on our website, which is citrinehealth.org. And while you're there, you can also check out our other programs, such as the Breast and Cervical Health Program for women to get free mammograms and PAPs, and the Basic Food Program to help people with food assistance. And don't forget to like and subscribe to receive notices of future interviews. Thanks so much for joining us.